Welcome to this live webinar where we are talking about how to train your clients through and around injury. This is potentially one of the biggest reasons that our clients stop training with us, both personal training clients, if that's the game you're in, or if you're in a semi-private, a small group, a large group type setting, or even just a gym membership. It's one of the biggest reasons that people stop partaking in your service. So what I want to do today is give you a very clear guideline, a very clear step-by-step process of exactly what it is that you need to be doing to be working around injury in your clients and providing some value. Now, of course, because this is such a common problem for people, this can also really differentiate you in a crowded market where you can be the person to go to, not only to get extra health, extra fitness, to achieve people's goals, but also to be able to work around injury. So let's just basically define the concept of what injury is first. We can very simply define it as when a load or a force is applied to the body which is greater than what that body can handle. So this is broadly categorized into acute and chronic injuries. Think of an acute injury like you have a rope suspending a weight and you take a sword and you cut through that rope. That's an acute injury. There's one single bout of force on the body. A chronic injury, more of an overuse injury, is where you have that same rope, that same weight hanging on the end, and you get a nail file and slowly saw through fiber by fiber. It doesn't matter which of those it is, how we can approach and treat/work around this injury is going to be very common. One of the things we do need to remember is injuries can take a lot longer to remodel than people think. So from about a minute into the injury, when you have things like vasoconstriction of blood vessels, coagulation of blood, right through to full return of strength, we can be looking at that whole injury process lasting from a single hour or a single minute for those first initial factors, right through to up to 24 months for full strength remodeling in some bones, tendons, ligaments, etc. So this is a long-term process, and when people feel like they're healed, they're potentially not healed yet. Let's talk about the two challenges that I think we face. So there are two challenges of injury that we face when working with our clients. The first thing we need to try and do is assist them in rehabilitating the injury. Now, of course, if you're not necessarily qualified in that field and that's outside your scope, your client maybe would be working with a sports doctor or a physiotherapist or some sort of allied health professional. However, you can contribute to this process and aid in the rehab process, and having a little bit of knowledge here, as long as you know where you stand, what you know and what you don't know, can be very useful. So that's our first challenge, to rehab the injury. Our second challenge, and this is I think where we can really come into our own, is to exercise as normally as possible without injury aggravation. And this is absolutely key, because someone doesn't want to turn up to a class and be put in the corner with all the other injured people. While everyone does their fun workout, they're over in the corner doing something completely different. Everyone else is going for a run and they're just in the corner on the rower on their own. It damages culture, and chances are they're going to stop, and then maybe they will stay stopped in the long run, and you're limiting your capacity to help them and of course to help your business as well. So how can we get them exercising as normally as possible so they don't feel like an invalid, feel like a disabled person over in the corner, but someone who's able to take part and get the same sort of stimulus that the programming intended? And this is absolutely key, because if you are programming smart, responsible and efficient work for your clients, if you're programming work for your client which is effective, then there should be real intent to your programming. It's not just a random collection of exercises you've thrown together. There's a real intent. So if we completely change what that programming looks like because they're injured, then you lose that intent and you're not taking them towards their goals as you should be. So how can we change or modify the exercise the smallest amount possible so they're still getting as close to the same effect as you humanly can get them? So what I want to run through with you, and this is your sort of takeaway, take-home cheat sheet. This is the big takeaway from this. This is what you can actually go and use. And I will post this list in comments below, so you have this as a reference. What I want to talk you through are 7 stages of injury modification. So this becomes a very simple equation here. Someone comes in, they tell you they're injured, there's a certain body part which is injured, and there are certain movements they can't do as a result of that. In fact, guys, as we go through this, whether you're watching this live or on delay, feel free to post and comment below. Let me know a client or a member that you've worked with recently. I want to know what body part was injured and what movement you were unable to do as a result of that injury. If you can post that, maybe we can brainstorm some ideas for what potentially that person could do or could have done being in that situation. So let's talk through these. There are 7 questions that you ask. We start with question 1, we end with question 7. We work our way as far down this list of questions as we need to be able to establish what to do instead of the exercise that's aggravating their injury. Let me talk you through this list first, then I'll explain it, and then we'll go through and talk about how we would modify for a pretty typical injury. So the first step is, can you reduce the load? The second question, can you reduce the volume? The third question, can you reduce the speed or the power of their movement? Question 4, can you reduce the range of motion of the movement? Question 5, can you reduce the contraction type? Question 6, can you change the movement but keep the stimulus, the intended stimulus, and the intended muscle activation patterns? And then question 7, the final question is, can you do that same movement but single arm, single limb, and not aggravating the injured limb? So what we want to do is we want to stop as soon as we can as we work down this list of questions. The alternatives, the changes, the injury modifications at the top of the list are closest to the initial stimulus, to the movement that you're trying to modify. The questions down the bottom of the list are the most removed. So we obviously want to be as close as possible without aggravation. As we go down the list, the potential for aggravation is going to reduce, but also as we go down the list, it becomes more different to the intended stimulus. So let's first talk about the first question. Client comes in, they're injured. Can we reduce the load? Can you go a little bit lighter? You're getting the same volume, the same speed, the same power, the same movement patterns, the same range, but you're just doing it with a lighter weight. That's the first question. If the answer is yes, that's how you modify the movement. If the answer is no, we move down to question 2, which is reduce the volume. So maybe they can stay at the same load, but this is an injury which is exaggerated, or is going to be exacerbated rather, by doing too much work. So can you reduce the volume, be it sets or reps, some way that you're doing less total time under tension, less total work? If that's not going to help, if it is going to help, then we stay at that level. That's your modification. If it's not going to help, can we reduce the speed or the power? So reducing speed gives people a little bit more time to get feedback about their body's position in space. We slow down the movement and they can make little adjustments to potentially avoid the part of the movement which is going to cause them pain. If that doesn't work, can we reduce the range of motion? Maybe doing a full range movement is going to cause aggravation at a certain point in that range. Can we cut that range short so we are still getting the same sort of stimulus, but we're avoiding that point of aggravation? Question 5, can we change the contraction type? Of course, our muscles can contract eccentrically, they can contract eccentrically, concentrically, or you can have an isometric hold where you're just holding a still static position. Can you just do an eccentric maybe, and then assist them with the concentric? Do they get pain in the eccentric? Therefore, do you only do the concentric movement? If they both cause pain, can you do isometric versions of the same movement? If that is a good alternative, that's your change. If not, we move a little further down the list. And this is where we change the movement. So they're no longer doing the initial movement you intended, but there's the same sort of muscle activation type. And we'll talk about this in an example in a moment. But can you have still the same muscles working, so you're still training the same thing? So when you do go back to the movement that you are modifying, you've really limited how much loss they have in strength or quality of movement there, or in their stamina. Finally, can you train the opposite limb? And this is called contralateral training. And there's a principle called cross-education, which says that if someone has their arm in a sling, so the right arm's in a sling, trains only the left arm, because of the type of motor activation, your brain telling your nerves, telling your muscles to contract, because you're still getting that pathway going on your left limb, it will actually train and retain a lot of the neurological movement patterns in the right limb. And it can actually delay not only that, but surprisingly can also delay the loss of actual muscle mass of the cross-sectional area of the muscle. So that would be our 7th question. If none of the other steps work, can you go with that? Right, let's give an example. Let's say that someone has a shoulder injury, and the shoulder injury is stopping them from doing any overhead pressing, for example. And again, guys, if you have a client you're struggling with, post in comments below. Let me know the injury site and let me know the movement or movements, if you like, that you're struggling with, and we can talk about some ideas that you can be working around. So, client, shoulder injury in their right shoulder, unable to press overhead due to pain. Question 1, can they reduce load? They would normally be pressing 40 kilos overhead. Can we do 35 or 30 or 20 or 10 or 5 and keep everything the same? If the answer is yes, great, there's our modification done. If not, let's work to the next level down our list of questions, and that is reducing the volume. Can you have them doing the same load, that same 40 kilos that they would be doing, but instead of sets of 10, maybe they're doing sets of 8, sets of 5. Instead of 5 sets, maybe they're doing 3 sets. It doesn't take a lot to maintain strength. It takes a lot of work to gain strength after that initial increase, but it takes a surprisingly small amount of work to hold on to a good degree of strength. Question 3, reducing the speed or the power. Maybe there's some sort of impingement that's going on, and if there is incorrect movement or winging of the scapulae, there's some sort of issue with the stability of their scapulae, of their shoulder blades. Maybe when they go slower, they're more able to make that connection between scapular position in their brain and can adjust the position as they go to avoid that impingement, because they're not getting the elevation and their scapulohumeral rhythm is now correct. So reducing the speed or power of that movement. If that doesn't work, can we reduce the range of motion of the movement? So maybe they're only getting pain through that sort of standard arc of pain that a lot of people get from somewhere around 70 degrees, maybe to 110 degrees. If that's the case, can you do the pressing of pins where they're starting at their forehead and pressing there, starting from their forehead and pressing from there? They can still get this overhead strength, they can still train this same movement, but we're now starting to reduce the range. Maybe the pain is with lockout and we work only at that lower range, maybe from a front rack position through to the top of their head. If that doesn't work, we look at changing the contraction type. So 3 examples here. We could go eccentric only, we could go concentric only, and we could go isometric only. And that is the order in which I would do these. So my preference would be, if you can, to retain the eccentric portion, just because there is so much benefit of eccentric training. Let's say the same person, shoulder injury on their right, is getting pain doing their strict pressing, and the pain is occurring maybe down the bottom, and it's occurring on the concentric only. That eccentric lowering phase is fine. What I would suggest doing is have that individual do a push press, a jerk, something with a little more power to get it overhead, so they're not having to initiate that movement through the painful range. Now, of course, that's going to be very easy for them with it being a stronger movement than a strict press, but then bring in a slow 5-second eccentric on the way down. So push press or a jerk to get it overhead, slow 5-second eccentric. You can spot them with this movement as well. Obviously not super easy with a strict press, but with other movements you could spot the individual for a squat or a bench press, etc. You can spot with 2 people if you have that luxury, of course, with movements like deadlifts and the strict press that we're talking about. So can you do eccentric only? Let's say it's the eccentric phase that aggravates this individual with a shoulder injury on their strict press. So can you do the concentric phase only? So that would involve something like lifting off blocks, off jerk blocks, where the individual will start here, they will press and then drop the bar. Press, drop the bar. So now they're getting that concentric loading. My preference is to stick with the eccentric if you can, but if the eccentric is what's causing pain, sticking with that concentric only. And finally, can you do some isometric work? So can you maybe set the pins in a rack at various points and pressing at a certain rate of perceived exertion against those pins for a set number of seconds and then going into a rest. And of course, you can set those pins at different heights there to enable this individual to train through different ranges. And this is a great way to get the muscle activation patterns without a lot of the movement, which often causes some of the pain. So if that works, excellent. If not, we move down to question 6. And question 6 is, can we change the movement but retain the stimulus and the muscle activation patterns? So maybe this would involve taking a bodyweight movement and making it externally loaded, taking an externally loaded movement and making it bodyweight. In our example, someone getting pain doing a strict press with this right arm, could you have them doing a dumbbell strict press where you're in a little bit more of a neutral position? It can often be a less compromising position for that shoulder joint. Can you have them doing that? Can you change the plane of movement? Maybe you put in a bench press instead, or an incline bench press instead, or a combination of the dumbbells and the incline bench press, for example. An example that I use a lot in this case is when people have a knee injury, meaning that they can't do a lot of anterior chain type movements. So they can't front squat maybe, or maybe they can't lunge due to knee pain. We would have them doing a backward walking or running sled or prowler drag, which can give you a lot of those same muscle activation patterns, at least through sort of quads, rec fem. You can get a really good quad burn from that. It's concentric only. There's no eccentric phase, of course, with prowler or sled work. So that can be a really good way for people to hold on to and retain strength in their squat, even though they're not actually squatting, just by doing that backward prowler drag. So changing the movement, but keeping the stimulus and the muscle activation patterns. Some people try to modify this. I used the example before of people over in the corner rowing because they can't go for a run. If you look at the muscle activation patterns in running versus rowing, very, very different. It's extremely different. Maybe modifying a power clean to rowing could be valid because it's got that posterior chain activation and some sort of upper body pull type movement. So maybe that makes sense. Yes, you're potentially using the same energy systems, running for 20 minutes and rowing for 20 minutes, but we're looking at the muscle activation patterns. And if your programming is good, you will have paired or coupled your movement with something that makes a lot of sense. So if you were trying to program a conditioning type session where you were shunting blood between two different movements, we could look at doing something like a row, which is posterior chain and pull dominant, and pairing that with something maybe like a thruster, which is more anterior chain and press dominant. Now, let's say this individual was doing these two movements. Rowing was causing problems, so they ran, or running is causing problems, so they row. It's suddenly going to throw the balance of this session out. So if we look at running, maybe cycling is going to be a better option there. But keep that muscle activation pattern as close as possible because that's really important if you're trying to get a certain stimulus or a certain effect from that session. And finally, our final question, if none of these work, can you train that opposite limb? And of course, this is pretty simple with the example here of the shoulder. If their right shoulder is out of action, maybe it's in a sling, can you do that single arm press with a dumbbell, with a kettlebell, with some sort of single arm movement on the left? And as I mentioned, you can get this cross education where you still get a lot of benefit on that injured limb, even though it's not actually moving. Work your way through this list, guys, with your clients. And again, you can check this out in comments below at the conclusion of this webinar. Ask yourself the first question. If that works, great, make the change, problem solved. If not, work your way down the list, stopping at the first level, which is going to be appropriate and safe for your client. You want to be spending 2 to 3 sessions at that same level of intensity, of that same level of stimulus. So if they are reducing the range of motion, and that is what is affecting it, and that's what's working well, so maybe they're doing that press off pins just from their head upwards. If that's what they're doing, once they can do that pain-free for 2 to 3 sessions, then say, okay, can we work up this continuum? Can we work up the list? Can we now go to the full movement, or at least increase the range over which they're working, set those pins a little lower? If you do that, reworking your way through this list every 2 to 3 sessions, or every 2 to 3 times that they make a modification for that specific movement, in this example, for that strict press, you work your way up. Eventually, you'll get to the top of the list where you're reducing the load. Then you gradually and progressively increase that load until you get back to and beyond what they were doing previously. So guys, that's it. Again, check comments below to see this list. Please post below with any issues that you're currently facing with clients, both the site of the injury and the modifications that you are looking to make for this person. And I'll do my best to run through some ideas with you as to what we can do to work around these issues. Thanks, guys. I hope this has been of use. Post your questions, thoughts, and comments below. If you want to reach out, dan@rangeofmotion.net.au. Thanks, guys. Speak again soon.